Yeah, so 1996, medical cannabis had just passed in California. The federal government was really actively working to stop it. And some of the first people that they went after were doctors. And there was a court case and a big legal battle with three doctors from California. Dr. Tod Mikariya was one of the main doctors because he had recommended cannabis to, I think, over 10,000 patients. And so they wanted to make an example out of him. And the federal government was threatening to take away these doctors' licenses for discussing cannabis with their patient. That case went all the way to the Supreme Court because it was a First Amendment rights case. And it's all about free speech and a doctor being able to have free speech with their patient and talk about different therapies and treatments that might work for their patient, even though those therapies might be illegal under federal law. Dr. Tod was a really great person. He was in the movement from the beginning. He was friends with Dennis Perone and Brownie Mary. He was kind of known as a more progressive physician. He helped champion harm reduction in the 70s. And when cannabis started becoming more acceptable and getting legalized, he was one of the first physicians really getting behind it and really trying to change the stigma around cannabis in regards to medical patients, especially in regards to terminally ill patients. Because we've just seen dramatic results with patients where cannabis just improves their lifestyle, it improves their disposition, and it improves their health dramatically. And so it was really important, and Dr. Tod understood that the work that he was doing then was going to save millions of lives down the road. I think harm reduction is more of a sort of generalized concept where we started using it in regards to cannabis because of cannabis not having side effects, not having, negative long-term effects on the body. And I believe before with harm reduction, they would consider like substituting alcohol for heroin. Alcohol is still bad, it's still detrimental to your body, but it's not as bad as heroin. And so it was basically trying to change people's personal behavior. So you have like the ladder of drugs, and the really bad ones are on the top of the ladder, and they understand that people are still going to be on the ladder. They just try to get them down a couple rungs. So their feet aren't on the ground, they're still on the ladder, but if they fall off, they're not as high up there.